Welcome back, everybody, for another deep dive. Today, we're going to be taking a closer look at high-flow nasal oxygen in the ICU.
Definitely a hot topic right now.
It is, and whether you are a seasoned medical professional or a student or just someone who loves to geek out on cutting-edge medical tech like me, this deep dive is for you.
Absolutely.
You sent us some really fascinating research on HFNO and how it's changing the game for patients in the ICU who need a little help breathing.
Yeah, and I think what's really interesting about it is that it's not just about giving someone more oxygen.
Right.
It's about how you deliver that oxygen in a way that's actually comfortable and effective, and that's so important in the ICU.
So we're not talking about just those little plastic tubes they stick on your nose after a trip to the ER.
Not quite.
Okay.
It's more like stepping into a sauna. Think warm and humid. That's the kind of environment HFNO tries to create in the lungs.
Oh, interesting.
Using heated and humidified oxygen delivered through these special nasal cannulas.
Okay, so these cannulas are a little more heavy-duty than your average oxygen mask?
Yeah, they are designed for comfort, especially for patients who need that long-term oxygen support.
So it's about making the patient comfortable while also making sure their lungs are getting what they need.
Exactly.
What are some of the other benefits beyond just comfort?
Well, that continuous high flow of oxygen, it does more than just improve oxygen levels in the blood.
Right.
It actually helps flush out CO2 more efficiently.
Wow, so it's like it's doing like a cleaning cycle?
It is. Think of it like a gentle breeze clearing out a stuffy room.
Okay.
So the patient's body doesn't have to work as hard to breathe, giving their respiratory system a much-needed break.
So it's not just treating the symptoms. It's about easing the burden on the whole system.
You got it.
Okay, that's fascinating. Now, I've always heard that more oxygen is always better, but it sounds like with HFNO, it's not that simple.
You're right. It's not about just cranking up the oxygen. Precision is key here.
Okay.
Doctors, they carefully adjust the flow rate, the temperature, the oxygen concentration, all based on each patient's needs.
So it's personalized medicine in action.
Absolutely.
I love it. I love it.
It has to be tailored just right.
Okay, well, let's talk about the different ways that HFNO is being used in the ICU.
Okay.
One area that you highlighted in your research was acute hypoxemic respiratory failure.
Right.
Okay, so for those of us who don't speak fluent medicalese, break that down for us. What's happening in the body?
So basically, it means the lungs are struggling to get enough oxygen into the blood.
Okay.
It's a serious condition that needs immediate attention.
Yeah, definitely not something you want to mess around with.
No.
So how does HFNO step in to help in these situations?
Well, that's where it gets really interesting. You see, recent research is showing that HFNO can be just as effective as traditional treatments for this kind of respiratory failure, and in some cases, even better.
Better how?
Well, think about traditional treatments. They often involve more invasive procedures like intubation,
Right?
which, can come with their own risks and complications.
Of course.
HFNO offers a gentler approach.
Sure.
It's a less stressful experience for the patient, and it can lead to faster recovery times.
Yeah, that makes sense.
Yeah.
Less trauma to the body, quicker healing, always a good thing.
Right.
But how do doctors know if HFNO is actually working? What are they looking for?
They use something called the ROX index.
Okay.
It basically helps doctors track how well the HFNO is doing and make quick decisions about whether to adjust the treatment or consider other options.
So it's like a warning system.
Yeah.
Okay, that makes a lot of sense. Now, what about those situations where it's not just about getting oxygen in, but also about getting carbon dioxide out?
Yeah.
You mentioned the acute hypercapnic respiratory failure in your notes.
Yes.
What is that?
So in these cases, the main concern is that the lungs aren't effectively removing CO2, which is just as dangerous as not getting enough oxygen.
Right, so it's like a two-way street.
Yeah.
You need the good stuff coming in and the bad stuff going out.
Exactly.
Where does HFNO fit in here?
So HFNO may not be the first-line treatment for acute hypercapnic respiratory failure, but it can play a crucial supporting role. Often patients with this condition, they'll need non-invasive ventilation, which is a more powerful way to support their breathing.
Okay.
HFNO can be used in between those bouts of ventilation to maintain stable oxygen levels and keep the patient more comfortable.
So it's like a bridge between treatments.
Exactly. And a good example of how medical care is constantly evolving.
Yeah.
What we used to see as separate treatments are now being combined in innovative ways, thanks to, a deeper understanding of how the respiratory system works.
I love that. It's like medical teamwork.
It is.
That's fascinating. HFNO is a real game changer. It seems like it offers a gentler and in some cases more effective approach to respiratory care.
I agree.
Now, in your notes, you also mentioned that it's being used to help wean patients off mechanical ventilation.
Yeah.
That sounds really delicate. Can you explain what's involved there and how HFNO helps?
Sure. So imagine your lungs are like muscles that have become weak after being inactive for a while. When someone has been on a ventilator for a long time, those respiratory muscles can get deconditioned. Weaning off a ventilator is like physical therapy for your lungs.
I like that analogy.
It needs to be done gradually and carefully to avoid any complications.
You don't want to overwhelm them after they've been on a break.
Exactly, and that's where HFNO comes in.
Okay.
It provides that extra support, helping the lungs regain their strength and endurance.
Okay.
It's a much gentler step down from the ventilator.
Stepping stone.
Yes, allowing for a smoother transition back to independent breathing.
That makes sense. So research backs this up, I'm assuming.
It does.
Okay.
Studies show that using HFNO during the weaning process can actually reduce the amount of time patients need to be on a ventilator, which in turn reduces their risk of complications and improves their overall recovery.
That's fantastic. Now, what about patients who are already facing an uphill battle, like those with compromised immune systems? In your research request, you mentioned wanting to dig deeper into how HFNO is being used in these patients.
Right.
What makes this patient population unique, and how does their care differ? Right, when we're talking about immunocompromised patients, we're talking about people whose immune systems are weakened, maybe because of an illness or certain medications.
Exactly. And for these patients, any kind of respiratory infection can quickly become really serious, even life-threatening.
That makes sense.
So traditionally, doctors have been very cautious about using invasive procedures like intubation because of that added risk of infection.
Yeah, you don't want to introduce any extra risk into a system that's already vulnerable.
Exactly.
So how has HFNO changed the approach to respiratory care in these patients?
Well, for a long time, the thinking was to avoid intubation at all costs in these patients, even if it meant using less effective treatments.
Wow.
But as we've been discussing, HFNO, it offers this gentler, less invasive way to support their breathing.
So it's all about finding that balance, right, between providing effective respiratory support and minimizing risk.
Exactly.
Okay.
And what's exciting is that recent research like that Major study you sent suggests that HFNO can be a really safe and effective option for these patients, even in cases where intubation might have been the automatic choice in the past.
That is a huge shift in thinking.
It is.
So instead of automatically assuming a more invasive approach is necessary, doctors are now looking at the whole picture,
Right.
including the patient's immune status,
Exactly.
and choosing the least invasive option that will still be effective.
I think that's a great way to put it.
It's like personalized medicine is really taking center stage in the ICU.
It really is. And this shift, it's changing the landscape of critical care, making it possible to provide the same level of respiratory support to a wider range of patients.
That's incredible to think about. Speaking of changing the landscape, one of the things we came across in our research was the use of HFNO in tracheostomized patients.
Okay.
Now, for our listeners who might not be familiar with that term, a tracheostomy is basically a surgical opening made in the windpipe to help with breathing.
Right.
So using nasal oxygen in these patients seems a little counterintuitive at first.
It does at first glance, right?
It's like trying to fill a tire with air by blowing into the exhaust pipe.
I like that analogy.
It just doesn't seem like it would work.
Yeah, but what's amazing is that they've developed these specialized interfaces that allow HFNO to be delivered directly through the tracheostomy tube.
Wow, so they found a way to make it work.
They did.
That's incredible. What kind of results are they seeing with this approach?
Well, studies are showing that delivering HFNO this way through a tracheostomy can actually help speed up the process of removing the tracheostomy tube altogether.
Wow. So not only can it provide respiratory support, but it might actually help patients regain their ability to breathe naturally more quickly.
Exactly.
That's incredible.
It speaks to the versatility of this therapy.
Absolutely. From helping patients with acute respiratory failure to supporting those weaning off a ventilator, and now even in the care of immunocompromised individuals and tracheostomized patients, HFNO is really changing the game in the ICU.
It is.
So as we wrap up this deep dive, what are the key takeaways you want our listeners to remember about HFNO? Well, I think the biggest takeaway is that HFNO, it represents a paradigm shift in respiratory care. It's not just a new tool. It's a whole new way of thinking about how we support patients with breathing difficulties.
So moving away from those one-size-fits-all approaches and really embracing personalized care.
Exactly. And it's about recognizing that even in critical care settings, there's always room for gentler, less invasive therapies that prioritize patient comfort.
It's not just about keeping people alive.
Right.
It's about helping them thrive.
Right.
What else should our listeners keep in mind as they process all of this information? And it really drives home the point that medicine is constantly evolving.
It is.
What's cutting edge today could be standard practice tomorrow.
Absolutely. Research on HFNO is ongoing, and, we're learning more all the time about its applications and how to fine-tune its use for different patients.
So it's like a good reminder to never stop questioning, to never stop exploring, and to always be open to new possibilities.
Absolutely.
Especially in a field as important as, as healthcare.
Well said. And on that note, I have a final thought-provoking question for our listeners.
Oh, I love a good cliffhanger.
All right, so here it is. With HFNO gaining traction and proving its worth in the ICU, what other innovative applications for personalized respiratory care could we see in the coming years?
Okay.
Could we see this technology being used in outpatient settings or even in people's homes?
Oh, wow.
How might it shape the future of respiratory care as a whole?
Now, those are questions worth considering. So much to think about, so much potential on the horizon. A huge thank you to you, our listeners, for joining us on this deep dive into the world of high-flow nasal oxygen. It's been quite a journey.
It has. It's just the beginning.
Until next time, stay curious, everybody.